Welcome to this ASN Kidney 360 podcast. I am Antoine Lano, nephrologist at University Hospital of Caen, Normandy in France. Today I'll be discussing our study published in Kidney 360 titled Peritoneal Dialysis Patients Transfers to Hemodialysis, Causes and Associated Risks. What are the aims and methods of the study? The transfer to hemodialysis is a key outcome for PD patients, as it was highlighted in the SONG-PD studies. In this work, we aimed to explore the factors associated with different reasons for PD patients transferring to hemodialysis. It was a retrospective study. We used data from the French language PD registry, including nearly 16,000 French patients who initiated PD between 2002 and 2018. We focused on three key factors: the use of assistance for PD care, PD modality, CAPD or APD, and the suboptimal starter status, defined as beginning PD after a period of hemodialysis lasting less than 30 days. Using survival analysis accounting for competing events, we examined the association between these three factors and the risk of transfer to HD for 6 distinct causes: inadequate dialysis, mechanical complications, infections, psychosocial barriers, and other causes related or not to PD. What are the key findings of this study? First, we found out that nurse-assisted PD was associated with a lower risk of transfer to hemodialysis for infection in the first 18 months and for adequacy issues after 6 months spent in PD. Secondly, compared to APD, CAPD was associated with a lower risk of transfer for adequacy, infectious or mechanical issues after 18 months, but it was also associated with a higher risk of transfer for mechanical issues in the first 18 months. Thirdly, suboptimal starters had a higher risk of transfer due to psychosocial challenges in the first 6 months. What are the limitations of this study? Well, obviously, the study's observational design does not allow for causal conclusions, and prospective randomized trials would be ideal to test the causality of the associations that we found. Some causes of transfer, such as adequacy issues, could be subjectively assessed by nephrologists, leading to variability across centers according to their experience with PD. We adjusted these survival models for several variables, but some unmeasured confounders may exist. Variables of interest such as residual renal function and socioeconomic characteristics were not included due to their unavailability in the registry. How can the results of this study be used to change clinical practice or service provision? Well, 2 of the exposures that we studied are modifiable factors. Fully reimbursed nurse assistance is a distinctive feature of the French healthcare system. In countries without such coverage, allocating funds to expand access to nurse assistance, particularly in the early PD period, could help lower the risk of transfer due to infections and adequacy issues. When selecting a PD modality, patients could be informed about the benefits of APD in the early period and those of CAPD in the later period. Considering these factors alongside the patient's preferences would support a more informed decision-making process. Nephrologists could also focus on specific risks according to the chosen modality. And finally, recognizing the risk factors can help target specific patients with tailored preventive measures. For example, providing enhanced psychosocial support to suboptimal starters could reduce their risk of transfer due to psychosocial challenges. This study highlights the importance of personalized care in PD. By understanding the specific risk factors for the different causes of transfer to HD, healthcare providers can implement targeted interventions to improve patients' outcome and quality of life. Future research should focus on validating these findings and exploring the effectiveness of preventive measures in diverse patient populations. Thank you for joining us for this Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.